Welcome to Student Connections, where students connect with their community.
Hello and welcome to Student Connections on M6, your hometown station. I'm Mickey Brass and I'm here with Dr. Meyer from the Smile Guys across from Viking Stadium on Michigan Avenue. Thank you for joining us.
Thanks for having me.
So our first question we want to start off with is, what is the most dental problems that you see?
The thing that we probably do the most in my practice is just routine fixing of cavities. That still seems to be the biggest problem that we see, especially in teenagers right now.
Yeah, how can you tell if you have a cavity though?
A lot of times you as a patient can't tell when they're small. It does take either an experienced person to visually see it, or I can often diagnose them from x-rays.
And now how often should, or I guess I should say, what age should you begin to take your child to the dentist?
I like to start seeing kids as young as 2. That way we may not always do any treatment that young, but they get to come into the office, they get to meet myself and my staff, and it becomes a place of comfort for them rather than some place to fear.
And now after they start visiting after the age of 2, how often should they see the dentist?
As long as everything remains healthy, checkups every 6 months is what's considered standard of care.
And has your job changed much in the past 10 years?
Things have changed. Certainly technology has made things much easier in some regards. When I first started practicing, we used paper charts and we used film for x-ray, and now all of that's done digitally on the computer.
And now when we were talking about cavities, what are the dangers of cavities?
Well, the most obvious one probably would be pain.
Oh yeah.
Once the cavity reaches the nerve of the tooth, it's painful. Beyond that, because a cavity is an infection, you can have complications from the infection, and people do unfortunately still die from dental decay.
Really?
Yes.
Now, speaking of illnesses with your teeth, now, if you know gum diseases, how can you prevent gum diseases, and if you have them, how would you treat them if you got them?
The easiest way to prevent them, honestly, is just routine care. You need to make sure that you're brushing and flossing daily, seeking care with a dentist regularly, preferably every 6 months. If things don't follow that plan and you do end up having gum disease, there are treatments that can be done. The most basic one is a more in-depth type of a cleaning appointment with a hygienist or a dentist. Beyond that, it can involve surgery.
Now, you said that you have your hygienist do that. Do you ever fill with the cavities, help with the cavities?
That's my role. That's what I do. The hygienist takes care of the routine cleanings and treating gum disease. And then I treat the dental problems, the actual tooth problems, whether it be decay, broken teeth, things like that.
And you said sometimes you can get cavities through bad oral hygiene and everything. Now, what are some other things that come from bad oral hygiene?
Well, if you're not brushing and flossing regularly, certainly gum disease is one other possible outcome. More commonly, bad breath. You can actually have a lot of stain problems with your teeth, and they don't look very nice.
Can you get anything with heart disease or diabetes
from
that?
There has been a lot of study recently on the links between actually many different systemic diseases and bad oral hygiene.
Really? I just thought it gave you bad breath and maybe made your teeth yellow.
No, there's very strong links with heart disease, diabetes, arthritis, and now they're even saying Alzheimer's disease.
Really? Wow. And what are the causes of bad breath? What would be the cause? Just not brushing?
Well, predominantly the cause is from bacterial growth. If you're not brushing regularly, the bacteria that naturally live in your mouth kind of get out of control, and bacteria being a living thing, they do what they do, and their byproducts of living cause bad odors.
Now, when you see from the bad oral hygiene how your teeth get yellow, and you know how there's like teeth whiteners out there, what's your like input on that?
Tooth whiteners certainly can help if you have stains on the surfaces of your teeth. They're not a fix-all, but they can help. Whitening toothpastes do work. They take longer than something that I would do in my office for you because we're going to monitor things a little closely. We can use much stronger products than what you can buy over the counter. But most of the whitening products do work, and they do a good job.
Yeah, I know, because I bought the one Crest white strips, and they seem to work pretty good. But do you do any teeth whitening throughout the office?
We do. We both do an in-office procedure where we actually paint a bleaching agent on your teeth and activate it with a bright light. That can be done in the office. And we also do a take-home product where we make custom fit trays that you actually put the gel in yourself, and you can do those at home.
Really? Yeah, because those strips, I remember when I had those strips on, they were kind of jelly, and they made my teeth feel...
And they don't stay in place real well.
No, and they just made my teeth feel all weird after I had to go brush my teeth and get a glass of water. I was like, I did not like this.
Yeah.
But what one would you say works better if you were to choose one? Or if you saw results, I should say.
Anything that you do under a dentist supervision is probably going to work better, strictly because it's a much stronger product. You can get great results, and I've seen great results with the over-the-counter products, but there are disadvantages to them, like you just discussed.
Now, when we were talking about like things and it makes your teeth yellow and bad breath, would things that you eat or drink have a good impact on your oral hygiene?
Absolutely. Fresh fruits and vegetables are great for cleaning your mouth because of the fiber and the crunchy nature of them. They're actually helping to clean your teeth as you're chewing them. They're not going to take the place of your toothbrush, but certainly something that's crispy, crunchy is going to be better than something that's soft and sticky.
Yeah, I can see where you're coming from that. Now, when we were also talking about brushing teeth and everything, how often should you change your toothbrush?
I actually recommend every 3 months, or when you're getting better from an illness. So if you have cold or flu...
Yeah, kind of like how flu season's right
exactly.
right
as soon as you start to feel better, get rid of the toothbrush and get a new one.
Yeah, I'm feeling kind of sick right now. I should probably throw away my toothbrush after I get better. But we're going to take a short break. We'll be back with more right after this.
In order to beat breast cancer, I knew I would have to lose my breasts. But to reclaim my life, I chose breast reconstruction.
Each year, nearly 150,000 women will learn they will undergo a mastectomy due to breast cancer. But 7 out of 10 women are never told about their breast reconstruction options, and the numbers are even worse for minorities. That needs to change.
This living can't be called living if it's really only half a life. She's a flower that grows despite cement walls, and she will survive. She will survive.
I wrote the song Flower to raise awareness of this important issue. Breast reconstruction is a very important part of the healing process, both physically and emotionally, and all women should know their reconstruction options. Download my song Flower to share the message and help us share the knowledge that women can feel whole again.
Hello and welcome back to Student Connections on M6, your hometown station. I'm Mickey Brass and I'm here again with Dr. Meyer talking about the dentistry on Michigan Avenue, Smile Guys, across from the Viking Stadium. Now, back to talking about dentistry and everything. Now, what are some precautions that you can take to protect your teeth?
Well, one of the things that I advocate, especially here at the high school, is a protective mouth guard. Anytime you're in any kind of a contact sport, and even some sports that maybe you don't feel like should be contact, you probably should wear a mouth guard.
Yeah, because I play a lot of sports, and like I'll never want to, like I don't want to wear a mouth guard because I don't want to like have it hang out in my mouth and look dumb. But you know, it probably would be worth it, because what happens if I get my tooth knocked out?
Sure.
If I get my tooth chipped or something like that, and I just got my braces off. I don't want that to happen.
Right, exactly.
But like, let's say if I was playing a sport, if someone was playing a sport and they get a tooth injury, or a mouth injury or a chipped tooth, something like that, what should they do? Should they call their dentist? Should they go to the emergency room? Should they just wait? I heard some friends put it in a glass of milk. I don't know if that's true.
That's actually a good advice. Certainly if a tooth gets knocked out, you want to try to find it because a lot of times they can be put back in successfully. But if you just break a tooth, you even still want to try to find the piece if you can. With the advances that we've had in some of our bonding technology, we've actually been able to put teeth back together after they've broken, and the patient, you couldn't even tell after it was all done. But if you do knock a tooth out, like I said, try to find it, rinse it off even in just plain water, try to keep it moist, wrap it in a wet paper towel, or if you have the ability to put it into milk, that's great because it does keep the tooth hydrated, and it does make it easier to put it back in to the socket.
Now, so I know some people will get injuries that will mess up their teeth a lot, and like some of them will have to get braces because some of their teeth will get moved around. But if you were to get braces just on the normal hand, when can you tell someone needs braces? It
depends a little bit on the age of the person. We try to make those assessments early on. A lot of times I will send a child as young as 7 to an orthodontist for an evaluation if I can see that they're going to be exceptionally crowded. They're perhaps a small frame and their teeth are coming in and they're very large. That way the orthodontist can make the decision whether or not they want to do some early intervention.
Yeah, because I know some people, I know my friend Michaela had braces when she was like in 5th grade, and I was like, I didn't get mine on until 8th grade.
Right.
It's just, so I guess my teeth were just...
It depends a lot on the person. Some people can wait till later, and some need, like I said, a little bit more early intervention.
I know I didn't lose my first tooth till I was like really like late. Like I should not have lost it that late. And speaking more about braces, would you recommend like generic, like the regular metal braces, or would you say the new Invisalign braces?
Both work very well. The Invisalign has more, it's not as universal. There are only certain cases where it does work well. It's meant more for very minor corrections where the traditional brackets and wires can treat just about anybody very predictably.
What if someone's teeth were, or not just teeth, but their mouth, like when would they need oral surgery?
Oral surgeons do a lot of different things. Typically, most people think of the oral surgeon as taking out their wisdom teeth, which typically happens late in your teen years.
Oh yeah, I have to get that done in a few months.
But it can also be, you know, if their jaw is out of alignment and perhaps their lower jaw is much too large to fit with the upper jaw, then an oral surgeon would be involved in possibly doing some surgery to correct the size discrepancies. The surgeons also do treatment for placing implants. If a person is missing a tooth and they want to have a replacement, they can have a dental implant done. And they also treat cancer. If somebody develops a cancer, often it's the surgeon who will remove that.
Oh, really? Now, what about a little bit about sleep disorders with teeth? Now, how would you correct someone if they were grinding their teeth while they were sleeping?
There's a lot of different appliances that we can use. The most common one is called a bite splint, and that's used primarily for people who tend to clench and grind in their sleep. And it's a very simple appliance that you fit against your upper teeth and you wear at night while you sleep.
Really? It kind of sounds like a retainer almost.
It's similar to a retainer, and for some people it will actually function like a retainer. If they've had braces in the past and still wear a retainer, they won't need to wear both. They can wear just the bite splint instead.
Really? Now, what about a person if they have loud snoring issues?
A dentist can help treat that as well. I do have several patients that I help with their snoring issues, and we make what's called a sleep apnea appliance, which basically, again, you wear it when you sleep, and what it does is help to reposition your lower jaw so that as you lay on your back and things kind of collapse when you relax in your sleep, you actually cannot close off the airway, which is what's causing the snoring noise.
Now, when we were talking about like oral surgery and stuff like that, and you said something about oral cancer, do you do any oral cancer screening?
We screen every patient every time that they come in the office, honestly. We don't always tell the patient we're doing it, but it's something that we do every time we look in your mouth.
How does that happen? Like, how do you screen someone?
We do a visual examination as well as a manual examination, which basically just means I'm looking and feeling for anything out of the ordinary.
Is that what you do when you have like the little metal thing and you like move it and you like wiggle your tooth a little bit, or something like that?
That's a certain part of it. Typically what you're describing is going to be more of a cavity check, but what we're looking for when we're doing a cancer screen is more soft tissue stuff. I'm feeling in your cheek, I'm looking at your tongue, I'm feeling your tongue, maybe even underneath your tongue, which is a very common place to develop an oral cancer.
And now when you have products that you use and products that you recommend, what would you prefer that you want your patients to use for the best oral hygiene?
Whichever product that they're actually going to use is what I typically tell patients. For kids, a manual toothbrush works great, but if they're resistant to brushing, maybe they feel like typical kid, they know better. If you can use some kind of a gadget that gets them more interested, like a musical toothbrush.
Oh, like those tooth tunes?
Exactly.
Oh, I used to have those when I was a kid. I would have the We Will Rock You.
Yeah.
I used to jam to it in the bathroom.
If that's what gets them to brush, then that's what I'm going to recommend for them.
Now, but if you had to choose, so you would say that the mechanical one is better?
The mechanical one will do a better job if it's used correctly. Again, it's up to the person to actually put it in their mouth and use it. But if a patient asks me my preference on a mechanical toothbrush, I like the Oral-B toothbrush because it's got a nice small head on it. It's easier to get in all those little nooks and crannies. And the Sonicare toothbrush is also a wonderful brush.
Well, that's all we have for right now. Join us again. We'll be right back after this.
They've stormed beaches and freed countries. Protected the weak and defeated the strong. Shown courage and compassion. They've raised our flag and our hope. They've been called leathernecks. They've been called devil dogs. But above all, they're called Marines.
Hello and welcome back to Student Connections on M6, your hometown station. I'm Mickey Brass and I'm here with Dr. Meyer. Now, I understand that you have an office on Michigan Avenue across from the Viking Stadium.
Yes.
Do you also have another one?
I do, actually. I have a second office in Fort Gratiot, right next to the Blue Water Chrysler dealership.
Really? And what are your guys' hours?
I'm in my office in Marysville 3 days a week. The office is open Monday, Tuesday, Wednesday, Thursday, but we're not there all 4 days every week. We do an alternating day. I treat patients every Tuesday and Thursday in that office. My hygienist alternates her Mondays and Wednesdays.
Oh, really? And now at your offices, how many workers do you have on staff?
Here in Marysville, I have one hygienist. I have one administrative person at the front desk, and I have 2 dental assistants that work with me.
Oh, okay. And what are their areas of specialty? Like, what exactly do each person, like, what do they do? What is their job?
Well, the administrative person, she answers the phone. She handles all of the insurance billing and scheduling. She collects money, because obviously that's why we're there, is to make a little money. My hygienist is in charge of making sure that patients are up to date with their checkups, making sure that they're getting their cleanings regularly. And then my 2 assistants sit chairside with me while I'm doing my procedures. They are responsible for handing me instruments, making sure all my supplies are there in the room for us.
Kind of like your right-hand guys.
Exactly.
Right-hand smile guys.
That's
you
right.
Should say. Now, is it difficult to keep up to date with insurance companies and their policies, or not so much?
Very difficult. We tell all of our patients that we'll do our best to try to keep up to date with their policies, but especially right now with changing healthcare, it's very difficult to keep track of everything that's going on. We have hundreds of different policies that we work with based on hundreds of employers in the area.
Now, at your offices, well, let's just focus on the one here in Marysville. How many patients do you see day to day on average?
Typically, my hygienist sees one patient per hour, and we work about an 8-hour day, so she'll see roughly 8 patients a day. And then I can see anywhere from maybe 4 in a day if I have large procedures that I'm doing, up to some days where I'll see 20 if we happen to be doing lots of different small things in a day.
Now, how long have you been a dentist?
I graduated from dental school in 1995, so this is my 19th year.
Oh, wow. Well, congratulations.
Thanks.
And what made you want to become a dentist?
It was when I was a child, I had a lot of dental work done. I had a great childhood dentist. He actually invited me into the office to come work when I was in high school, and it just really kind of sparked my interest.
Really? Now, once you had it sparked in high school, once you started going around and observing dentistry, where did you go to get your degree?
Well, I went to Wayne State University for my undergraduate work, and then I went to the University of Michigan Dental School. I could have done my undergraduate work at U of M, but not every university has a dental school. Excuse me. So there are very few in the country actually that do. Wayne State was convenient. I lived nearby. I was actually given a pretty good scholarship to go to school there. So that's why I did my undergrad work there. I decided to stay in state when I went to dental school. We do happen to have 2 great dental schools in our state, University of Detroit and U of M. And I got into both and chose Michigan.
Now, when you said that your dentist influenced you and he had a great impact because of your dentistry, and you said about in high school, you got really into it. Now, if I was a high school student or just another high school student, what would be the steps that I could take to become a dentist, and what advice would you give them?
The first thing I would tell them is if you do have an interest in it, contact a local dentist and see if you can job shadow. And then after that, if you're still interested, then start looking into various options for which classes you'll need to take and where you might want to go to school. Most of your classes are going to be in the sciences, lots of biology, lots of chemistry, but I would encourage everybody to expand and also look at business courses, honestly, because ultimately what we do involves running a business.
Now, for being a dentist for 19 years, what is your personal favorite part of your job?
I like being able to see the befores and afters for people. I do get the opportunity to see a lot of people who have either had neglect or accidents where they come in to see me and maybe they're not very proud of their smile. And if I can take them through the whole process and at the end they come out of my office smiling and very proud of themselves, it's a great transformation to see.
Thank you for joining us, Dr. Meyer.
Thanks for
I definitely
having me.
got a lot of info on that, about cleaning my teeth and everything, and I'm sure the viewers at home did too. That's all we have for now on Student Connections. I'm Mickey Brast on M6, your hometown station.